to record it in case, whoops, we are live. That's not working. All right. After all the glitches, here we go. I recently befriended an incredible gentleman and learned his story, and he happens to be kind of sort of a high-profile individual. Brett Kessler, president-elect of the American Dental Association. It is just a joy to have you as a new friend and an honor and privilege to have you here with us. Thank you so much for joining us.
Awesome to be here, Alan. I've been a big fan of yours for the last year or so, and I think I saw you on a panel at the Greater New York meeting, and one of my goals was to, shake your hand, and unfortunately didn't get to do it. So glad we're getting to do it now. So
Well, we're doing it in 2D now. We'll do it in 3D at some point soon, I hope, Brett.
Look forward to it.
Guys, Brett is not your typical dentist. And that's pretty much why he and I struck very, very deeply with each other. Brett, you and I have a very, very big concern about the well-being of our constituencies. And I think it's no secret that mental health and dentistry are really being mentioned in the same sentence more. It always has been an issue. Now it's more and more of an issue. Talk to me a little bit about what you're seeing, and let's go in the direction of what we can do about it as an organization and as two guys who really, really care about this.
Sure. Thanks for the question. We have kind of a mental health crisis going on within our profession. 80% of us admitted to being burned out last year. Think about that. 8 out of 10 of us have admitted to being burned out as dentists.
Yes.
There are some unrealistic social expectations of dentists. If you remember 5-6 years ago, US News and World Report rated us the very #1 overall profession, not just the health profession, but the #1 profession. And it created a ton of potential new dentists who applied for dental school with the intent it's going to be the best job ever. It's a license to print money. We're going to make an impact on the world. And then we find out dentistry is really hard. It's hard on our bodies. Patients, associate us with pain. How many times a day did you hear, "I hate the dentist" from your patients?
Yep.
And so, but on the positive side, the work we do changes lives. It changes
Yes.
lives for the best. Creating someone's smile. One of my truisms that I say every day is a smile is a window to the soul, and I'm going to do everything I can to try and help my patient's soul shine through. But a lot of us get stuck in treating teeth and not treating people, and that's where we miss out with some of the higher volume practice modalities. It's hard to connect with patients on the highest level. And so myself, I had some of my own mental health issues. I'm a recovering alcoholic and addict. I got sober in my 3rd year of practice in 1998. And when I got sober, I got inspired to live my best life. When I got sober, it was something that no one talked about.
Yeah.
The stigma was so big, and it's still big. Okay. But one of my mentors suggested to me that no one ever gets to see the positive side of recovery. And you've got such an amazing outlook on life. Talk about that. And so I started talking about it within like 2 or 3 years of me getting sober. And, and from that day, I had basically lived my life intentionally as part of my recovery program to take care of myself. But it also, and that's just not to return to my old ways with alcoholism and drug addiction, but to how can I live my best life ever? And I set an intention to do that.
I think your points are so powerful. I just put up a quote today on Better, Richer, Stronger, that a leader is not somebody who generally has to motivate and uplift. Your humanity, your vulnerability, your openness about this, and this not only goes for the president-elect of the ADA, that goes for the dentist out there in the field, the assistant, the hygienist, the administrator, everybody. I think you illustrate this point that not a single one of us isn't carrying some burden. that is surmountable with help. With help. That is critical.
Yeah, it's a human condition, and most of us qualify as humans, though we
Yeah,
don't think
we hope
so.
so.
But we
Yeah,
don't think so because we're superhumans. We are taught, and a lot of it's internal, why we go into dentistry in the first place. A lot of us are perfectionists. We're taught to be high achievers, and we're taught to be self-sufficient
yeah,
and not ask for help. Because it's just part of our psyche, and it's part of our training. I used to teach at the dental school. I taught occlusion at University of Colorado, and from the get-go, we were expected as dental students to be perfect from the get-go. I failed occlusion in dental school. and, and I'm like, they sent me to art class, and I wasn't an art class guy. I was, you put facts up there, and I can memorize those facts and spew them back out. I can integrate it and assimilate it. But for me to use my hands, it was totally like speaking Chinese.
yep.
And so I had to go to wax camp over the summer where we, huddled around Bunsen burners and sang Kumbaya songs, and but I learned how to do it with practice, and I ended up, you know, doing a lot of those things. I do my own wax ups, and when I was doing aesthetic cases, and it's part of my process and how I determine what's possible for a patient. But then I was able to teach it. So yeah, failure, that was even before I got sober. Failure turned into opportunity.
Hmm.
And that's the key. If you can turn these failures, quote unquote failures, into learning opportunities, was it really a failure? Did I die from it?
The very
No,
well, yeah.
my
And
ego did.
I think, well, yeah, but that's okay too.
Right.
That's okay. I'm compiling a list of dirty 30 words or 30 dirty
Uh-huh.
words. Failure is one of them. Because I think it's only a failure if you refuse to get up and bring yourself up from it. A quarterback gets sacked. Mariano Rivera, the greatest closer of all time, he blew a save every now and then, but they come back stronger. And
Right.
certainly your story with your substance issue is a wow. My story also. I was Brett. I'm starting to admit that I was a panky flunky. I did the whole continuum, but I never hit that top. I never hit that top level, but I got pretty darn good. And it took me a long time to see that I was quite good enough.
Right.
Yeah, resilience from adversity. I want to just
Can I
steer
can I
in.
talk real quick on that
Please,
point,
please.
if you don't mind? A lot of us are so fear of failing because it's humiliating to us. It brings shame. And if you look at, humiliation, how can you shift humiliation to humility? Same word root, but very different
Yes.
meanings. Humiliation fraught with shame, fear, self-flagellation. I mean, it's just bad. Humility, how can I show up, recognizing fully well where I am, and how can I show up as my best self to be the best I can possibly be? That's the
Yes.
definition I use for humility, but it's the same word root, but very different meanings. And
Yeah.
to get through these things, we have to shift humiliation to humility.
Absolutely. That is a critical principle. You and I read the same things. I think I think Edgar Schein and Brene Brown. I
Yeah,
think these are two of my biblical axioms that humiliation is just inappropriate wherever you may go, and humility, the recognition that you need to be the best you can be to serve something bigger than yourself. I
right.
think that's that fine line that we have to stay on top of because we are in this. Once we realize we're in this for something really big, like the betterment of humanity, one person at a time,
Right.
that's when we start, in my opinion, Brett, and chime in on this, please. That's where we begin to combat burnout.
Absolutely. Absolutely. I'll shift into saying that when I turned 50, I'm 55 right now, almost 56. When I turned 50, I asked myself some mid-career questions, mid-life questions. What do I want to do with the second half of my life? I plan to live till I'm 100, till I'm 100. what do I want to do the second half of my life? What do I want to do with the second half of my career? Where can I make the biggest impact in the second chapter or this next chapter? And that was the year I decided to sell my practice. That was the year I decided to go on to run for the board of trustees of the American Dental Association. That was also the year I was able to participate in the Ironman World Championships in Kona, Hawaii. And it was also the year that I hit 20 years of sobriety. And I did it by intention. I asked those questions, and I moved into a different realm. Being a dentist for me was amazing. I made a huge impact on my patients, one patient at a time. My role as a trustee and now my role as president-elect of the ADA, I can affect entire populations positively
Yeah.
through some of my messaging. And that's what I hope to do.
Yeah. I let's move from there over to what you are doing individually and where you'd like to see the ADA going collectively. Let's start with this one issue. Let's start with this one issue of the mental health of our dentists, of our tribe. Where do you see us going? Dr. Brett Kessler and also the ADA, and hopefully you'll drag me along on your journey with anything you're doing.
Well, I need you on my journey. I need everyone who is outspoken about us being our best selves needs to speak up. So that's really important. And so that's what I do. I share about my journey. And in 1998, I wasn't sure I wanted to live, let alone be a dentist. And there's lots of people who are in that mental space right now. We lost another dentist to suicide a few weeks ago. And it's just, it kills me to wish I could have gotten to that person, that one more person. And a lot of people will call me with questions and and they're hurting and what do they do? And I love the opportunity to talk to people. And I know you do too, Alan. And there's many of us out there that are doing that. So I hope that I can create a message of hope for those that may be struggling knowingly or unknowingly. And so I openly share my story and create conversations that will in turn lower the stigma, that will say, hey, it's okay to not be okay. Brett can get through it. Look what he did with his life. I can maybe do it too. And then from a structural standpoint from the ADA, we're working really hard right now to lower the stigmatizing questions that are asked on your licensure applications, as
Yeah.
well as your credentialing applications if you're trying to recredential for insurance or any kind of benefit plan. I'm 25 years sober. 6 months ago I was recredentialing with Delta Dental, and they wanted to ask me questions about why I went for treatment in 1997. Okay. And, I said, no, I'm not answering that. I've answered it before. I'm not answering it again. Well, you can't be recredentialed yet. Okay. Forget it. I'm not going to do it. It has nothing to do with anything. And so we are actively going around the country and asking the states to use, to use this as one of your advocacy points to change that, because it's driving people away from getting help.
Yeah, I remember the thing that got me into this was the tragic suicide of Dr. Andrea Bierman, who was a friend of mine from Pankey and other places where we intersected. And anybody who knew Andrea, 34 years old, man, 34 years old, being really propped up by the Pankey Institute to be their person on TMD. The day she died, anybody in their right mind would have sat in her chair and let her tear their mouth apart and build it back up. It's got nothing to do with competency. Nothing.
Yeah.
By the way, Paul Henney is watching us, and
Hi,
Allison
Paul.
House is watching us.
Hi,
Dina
Allison.
Ghost is with us. Dave Wicks is with us. So thank you guys for watching. If you want to pop up a quick question, I'm watching this on my phone as I'm talking to Brett. We're going to stick around for a few more minutes. But I think part of the problem in this profession, as the world is changing, the rules are changing, the game is changing, we have that disconnect. And one of the things that I've noticed in corporate models versus private models, expectations of our patients with the nature or the niche of the practice that they're working in, I think that causes a ton of stress, both on what the employee dentist or even the owner dentist who contracts with or does or doesn't contract with a high volume model. Those expectations and the realities, I believe, are creating some real deep inner conflict for doctor, for patient, for team, individually and en masse.
Yeah, there's so many thoughts going through my head around that. Most of my career, I'd been a private fee-for-service,
Mhm.
complete fee-for-service practice. I focus on this health, function, and aesthetic dentistry. It's a destination type practice. After I sold it, we started our own little group practice, DSO type thing, and didn't work out for me. So I moved on to another practice that was a higher volume PPO based practice, and I found joy in all the models that I've practiced in. And the the problem is the systems that we may be going into may not jibe with our value proposition, our personal value proposition. And that's where the disconnect happens. And we can take it for a little while, and we can get through it, just through sheer force. But if the value disconnect is there, eventually there will be some sort of issue. I'm on a work group with that was sponsored by the National Academy of Medicine. That's headed by both Victor Zhao, who's the president of NAM, and Vivek Murthy, our U.S. Surgeon General, addressing clinician well-being. And Vivek, in one of our meetings, talked about no one went into medicine to be experts at charting.
Yeah.
Electronic, and in physician world, nursing world, they spend most of their time trying to make sure their patient charts are full. Okay, and in our case, that's a thing. We have assistants that do that, help us with that and do it for us. But we spend most of our time, you know we're so busy, we see teeth, we don't see people.
Yeah.
And how do you connect with people? Because that the connection is what we all love about dentistry, in my mind. And so I gave my talk on my practice philosophy to a group of dental students in my district in the West over here. And how do you do some of these connective exercises in these high volume practices? And I talk about, well, you can't change the momentum once you're there, initially, and when you're there. But why don't you start with every new patient? Ask the patient, what are your goals for your teeth? What do you like to get out of this relationship with me, and how can I help? In your hygiene exams, you got 5 minutes for a hygiene exam. Sit the patient up for a second, look them eye to eye. What are your goals for your
Yes.
teeth?
Yes.
And, well, I don't have time to tell you all the things that are wrong. So you know what? Do your exam and say, hey, Mrs. Jones, I see some areas that I'm really concerned about. I don't have time right now to talk to you about everything because I've got another patient waiting. Can we schedule another time where we can sit and really talk about what's going on based on what you told me your goals are? And just
Yes.
shift that momentum, create a connection. No patient has ever been asked by a dentist, what are the goals for your teeth? Why is that? That's why we're there. We're there to serve. And I feel like every patient deserves to hear what ideal dentistry sounds like for them. And this is what it sounds like for you.
Yes. Paul, our friend Paul Henney just put something up, and it's exactly what's on my mind as I'm listening to you. Brett found joy in all three models because he changed locations, but not his philosophy toward people, health, and life. And yeah, I think that on any scale that you want, it takes some work, it takes some creative thinking, but put it the a talk I'm working on right now is love is the missing ingredient here. And I'm going to be giving that talk to a DSO organization at the end of April. But I think sometimes an appropriate little tap on the shoulder, it's okay, Mr. Kessler, everything's working out. Tell me about yourself. Just take a minute or two. And that could make all the difference in the world for us feeling it and for the patient feeling it and giving it back.
Yeah.
I think that's
Panky,
where we start.
Panky talked about know yourself, know
Yes.
your patients. The better you know yourself, the better you can be open to knowing your patients, the better you can be open to knowing anyone you're in a relationship with, and the better you can connect with the world. And we have these unique special gifts as dentists to provide a very special service that can make people healthier, can get people out of pain, can help a patient smile with confidence, can help a patient function for full assimilation of your food into your body for ideal overall health.
Yeah.
We have this gift. It's unique to us.
Yes, and we also have the gift of more frequent contact with these vulnerable human beings than just about any other, excuse me, I'm going to use the word practitioner, please. There's another P word that I will not use. Um, I I provided a home for my children and my wife, but I won't use that word here. We are practitioners of a profession. But I think we are in such a powerful position to do good. And I think you really get it, my friend, because it can be done in just about any modality with just a little bit of thinking, a little bit of heart
And
and
yeah,
brain.
and these little actions make
Yes.
big differences, big shifts. And when I did that for the first time in the office I'm in now, which was a very high volume PPO, teeth, the entire attitude of the staff, the team changed. They're like, wait a minute, we can really make a difference. And then they saw the patients catch on to this. And all of a sudden, let's talk about money. Instead of doing one tooth at a time, I was now doing sections of mouths at a time because I offered them the opportunity to share what their goals were.
Mm-hmm.
And I'm still in a PPO practice. So I lost that opportunity for production in that moment to gain a 10x 3 appointments later.
Yeah. Yep. One of the things that I do, and I did it probably the last 12, 13 years of my career, and I'm still doing it. I'm working for a military contractor.
Uh-huh.
And I have so much fun with these soldiers, and we got to blast them in and blast them out. But a little touch, a little warmth, a little kindness, a little care for the guy who's going to put his life on the line or her life on the line for us. I got a batch of them to stop smoking. I got a batch of them to stop chewing tobacco. And they've come back to me. I don't even remember them. They flashed by me so quickly. I've had them come thank me for saving their lives.
Yeah.
Just with a little, it doesn't take a lot. This is basic triage. It's meatball. It's tier one, but you can accomplish something there. And I felt so heartwarmed from it all. Let
What an
alone,
honor.
yeah,
What an
yeah.
honor.
And when you look at your position as an honor, whether you're fee for service, PPO, FQHC, or anything, so, Brett, we, we have a limited amount of time. And first of all, we are going to record another session, please.
Definitely.
Yeah,
Yeah.
you know,
We got a
I'm
lot to
from
talk
Jersey.
about.
I'll either bribe you or blackmail you. I don't care. But one thing, one parting shot, and thank you everybody who's watching, Paul and Dina and Susan and Allison, everybody. Um, Give me a parting shot. One thing you would look a young dentist, a 10-year or less experienced dentist, and or a dental student, you'd look that student or young person in the eye. What should they do? What do you suggest they do to maintain that level of happiness that you and I have acquired through our experiences?
Thank you. Dentistry is what I do. It's not who I am. I'm a human being that practices dentistry, and it's my own unique gift, as I said before. You are your most valuable asset. Okay. Dentistry provides a really nice life for me. And I was able to provide for my family and live, some amazing, amazing tales that we don't have time to talk about. But I am my most valuable asset, and I have to take care of myself as such. So I look at wellness in 5 dimensions. The first is physical wellness. Take time to get your heart rate up on a regular basis, stretch, push some weights around, be diligent with the food you eat, make sure you get enough sleep. Okay, dentistry is very hard on our body, and it affects us to the point where many of us miss segments of time because we can't practice. We're in too much pain. Take care of yourself as your most valuable asset. You can't produce if you're not physically well. Intellectual wellness, grow your intellectual capacity. Read books. I see a book right behind Alan on his right shoulder there. Okay, enjoy the ride. Find ways to grow your mental capacity. Keep your brain growing. It's plastic. It can be moldable. Well, who you are today doesn't have to be the person you are 5 years from now, but with intention, you can really grow your your intellectual capacity. Okay. Emotional wellness. Feel your emotions to the fullest extent that you can in the moment. If you can't, keep seeking ways to find it out on your own. If you can't, seek help with professionals who help you process your emotions, whether they're good, whether they're bad. If you're stuffing bad emotions, they will come back out to haunt you down the road. Promise that will happen. Okay. Spiritual wellness. Find ways to grow your spirit. Some people go immediately to religion when I say spiritual wellness, and that's great. If that's how your spirit is growing, great. Find ways to keep that fire lit in your heart. Find ways to make you enjoy every single day to the fullest extent. It makes you want to get out of bed, ready to attack the day in your purpose, and grow that on a regular basis. Social wellness. Find your tribe, find the people that will challenge you, but value the same things you value. And they are supportive of you, even at your best, even at your worst, as you are for them. And because we can't do this alone. And view our colleagues as colleagues, not competitors. All boats rise with a rising tide. And I can tell you, I'm 27 years in my practice life, and I've got friends that practice right next to me, and I don't view them as competition. There's enough patients to go around, trust me.
Yes.
But only dentists know what we know, and only dentists experience what we experience, and don't be
Yes.
afraid of that. So if you spend time in all 5 of those: physical, emotional, intellectual, spiritual, social, you're gonna have a pretty good life. Thank you.
Wow. Just how in the world are we going to top this one? But I got to say this, Brett, and you may have to buy a hat that's slightly larger, but to see the leadership of the ADA falling into your hands, and with tremendous respect for all of your predecessors who are doing a job that can sometimes be thankless and unrecognized, but to see the caliber of individual that you are, the life lessons that you've learned, in addition to the business and practice lessons that you've learned, I am really fired up about the future of the ADA, the future of our profession, and what a gentleman like you is going to do to help us keep this profession a profession of joy and reward. Not only on the material, we're all going to make enough money. We're all going to make enough, but the spiritual reward and the mental health recovery of our practitioners, I think we're in great hands, and I am fully in your support. And anything that I can do, or this community can do, to help your mission, speak for myself. I'm there.
Thank you.
Brett, we're going to talk a little bit more on a recorded thing we're going to do now, and we'll air it later. So everybody, guys who've joined us live, Barry Polanski is here, Brett Burris is here, Marcella is here. We got some people here, but thank you.
All my mentors are watching. Thank you all.
Barry Polanski has been a mentor and a tour mentor for me, but
big mentor.
A wonderful voice for reason in dentistry. Good friend. Listen, everybody, get out there, have a great day today. Live healthy, eat right, get some sleep, like Brett says. get some exercise, make somebody's life better today. Let's get out there and do that. That's what we're here for. And absolutely, Brett and I are enjoying the ride. Get out there and enjoy it too. We'll see you next time, and we're going to replay this. I'll see you later. Stay
Bye,
with me.
everybody. Thank you.
All right, I think we're off. And I'll end the recording here.